I am Dr. Neeraj Jain. I am a consultant neurologist at various hospitals in Navi Mumbai. I am also associate professor of neurology at KM Hospital, Mumbai. Through this video, we want to spread the awareness about the epilepsy myths and how to basically manage the patient who has uncontrolled epilepsy. Epilepsy is a very common disorder in general population, and whenever a person witnesses a seizure, he should be taken to a neurologist for proper evaluation and further guidance. Epilepsy can be diagnosed by simple investigations like EEG and MRI. And once epilepsy is diagnosed, then usually it can be very well managed with various anti-epileptic drugs. Person has to comply with the medicines, person has to regularly follow up with the neurologist, and person has to take certain precautions. The precautions for general population in patients who have epilepsy is like to avoid driving, to avoid fasting and have proper medications, and to have proper sleep. They should follow a routine lifestyle methods, and they should not vary the sleep timings too much. There are various anti-epileptic drugs available for different age groups, and with the newer and newer medicines being launched, the side effect profile of these drugs are being less. So person should not worry about the side effect, and they can follow up with the regular neurologist to have an idea about the various side effects the drug can have. Women with epilepsy can definitely marry and can have children, or there are few precautions which need to be taken whenever they conceive a baby, and a neurologist might change the drug which you are going on whenever she plans a pregnancy. Children need special precautions because their education can be affected, and they have to have certain other precautions like going to a school, and they can have a seizure. So parents with children having epilepsy should know the primary aid of epilepsy. In in children who have febrile seizures, basically the aim is to control the fever and to give anti-epileptic drugs on SOS basis. In children who have regular convulsions, basically what we need to ensure is to have a proper regular anti-epileptic drugs. Children with epilepsy also needs special attention to their education, because many of the children who are on long-term drugs, they can have problems in the education. So they need special training, and it might be a special teacher to educate themselves. It is a myth that epilepsy cannot occur in elderly population. Epilepsy is equally common in elderly population, and they need special drugs, and there can be various reasons in elderly, like a stroke, or there can be some infection or a tumor in this age group of above 50. They also need special care because of the risk of falls, and they can fracture their bones during the convulsions. So a regular amount of anti-epileptic drugs and with regular follow-ups is the most important. There are certain precautions which an epileptic person need to take, like he should carry an identity card with himself, and he should make the persons who are there at the workplace, especially like in school, you can make the teacher aware that the children is having epilepsy. At the workplace, the colleague should be aware that the epilepsy is a problem in this person, so that whenever there is a seizure at the workplace, they can get timely attention and timely management. You should not get panic when the person gets seizure. Person should be made comfortable, the tie should be loosened, and person should be made lie on the side, so that whatever the frothing is there, it comes out of the mouth. We can wait for 5 or 10 minutes, because most of the convulsions which are single episode, they recover in 5 to 10 minutes, and after that timely medical attention can be sought. There are various myths around this epilepsy, that epileptic women cannot marry, epileptic women cannot have children, but then all myths are false. A regular follow-up with the neurologist with proper consultation, I think most of the myths can be solved, and I do think that epilepsy is a very controllable, and most of the person can lead a normal life with this epilepsy. There are various newer options available nowadays for epileptic patients who are uncontrolled on multiple drugs. Epilepsy surgery is one thing, in which a portion of the brain which is responsible for the continuous convulsion is removed. So a proper consultation with the neurologist to understand what type of epilepsy you have, and whether this is a surgically remediable epilepsy should be discussed. Now, with the newer and newer modalities of the investigation available, we are able to diagnose more and more patients with the lesional epilepsy, and if the lesion in the brain is identified responsible for epilepsy, then it can be successfully excised. Surgery is probably a cure for few of the patients, and I do think that epilepsy surgery should be sought in any person who has uncontrolled epilepsy, especially if the person is on 4 or 5 drugs. With this video, we want to spread the awareness of the epilepsy in the general population and about the convulsions in general. And every person who has epilepsy should be taken to the medical attention as soon as possible. Thank you.